more in-depth info on all the lesions. So, first up, the group of injuries to soft tissues. So remember, these are lesions that are due to injury. So, hematoma, what is this? An injury from an accumulation of blood in tissue due to trauma. So basically, you hurt yourself on your cheeks or something like that, and you have an accumulation of blood in your tissues, which makes it swell up and turn red and purplish, and it's filled with blood. You typically see it on the buccal mucosa. Frictional keratosis. This is easy to remember because the name says what it is. Friction and then keratosis. It's keratinized tissue that develops in response to friction, such as biting or rubbing. An example of this would be linea alba. And then you have nicotine stomatitis. This is when you see little red dots on the palate, and it's due to the effective heat from the cigarettes on the palatal mucosa. It indicates that the person is a heavy smoker. It usually presents as erythematous palate. Later presents as keratinization with dark dots, or orifices or holes of minor salivary glands on the palate. Is nicotine stomatitis reversible? Yes, it is reversible once the patient stops smoking. So here's an example. Again, you can see the dots are openings of the salivary glands, and this is where the heat rises up onto the palate from cigarettes. It starts out red, and over time the body creates thicker walls of keratin over the salivary gland openings, which is why it starts to turn into white circles with the red dots in the middle. There's another picture right there. Tobacco pouch keratosis. This is a white lesion located where chewing tobacco is placed. So basically, if you have someone who uses chew, you're going to be looking for this type of lesion, tobacco pouch keratosis. It's most often placed in the mucobuccal fold, and early lesions have a granular or wrinkled appearance. Later on, it becomes more thick and corrugated. Corrugated means it looks like the ends of the cardboard in the picture. If the patient stops chewing, can the tissue go back to normal? Yes. If the patient stops using chewing tobacco, the tissue will heal and return to normal. So how do you treat this? Well, it may require a biopsy. If you're having someone chewing tobacco for a long term, they have a super increased risk of squamous cell carcinoma, which is the oral cancer that is common with chewing tobacco. There's a picture of it. Again, it's a white lesion, mostly on the mucobuccal fold. Okay, amalgam tattoo. Amalgam tattoo is pronounced argyrosis. It's a pigmentation of tissue, and it's usually blue or black due to the silver in the amalgam. Most common location to see this is on the posterior region of the mandible. Melanosis. Melanosis is easy. It's an increase in melanin. Be careful because this can be really confused with amalgam tattoos, but melanosis doesn't have to do with amalgam or silver. It just has to do with the pigmentation of the tissue. Actinic cheilitis or solar cheilitis. So this is when you look at the lips and the vermilion border has faded from like a sunburn. It can turn into actinic keratosis, which is the next step up below cancer. And then usually both lips can be involved, but the lower lip is more severely involved. And I think that's because our nose protects our upper lip from the sun. It's more seen in men than women. Mucocele. Mucocele is a tiny vesicle or blister that plugs up the minor salivary glands. It's an inflammatory response, and then granulation tissue forms, and then the mucus is walled off to form a cyst-like structure, but it's not a true cyst. You see this a lot on the lower labial mucosa, and that's the most common site. Necrotizing sialometaplasia. A benign condition of salivary glands. It's thought to be the result from the blockage of blood supply to the affected area. The ulcer usually heals by secondary intention, which means there's a lot more granulation tissue involved, most commonly seen at the junction of the hard and soft palate. So, this is similar to mucocele because it's affecting the salivary glands, but when you think of necrotizing sialometaplasia, I want you to think of the palate because it's focusing on the palate between the hard and soft palate. Here's an example of it. So it's basically happening because not enough blood supply is going to the salivary gland, so the tissue starts to die. Necrotizing, necrosis, tissue dying. Okay, sialolith, a salivary gland stone. It may be found in both minor and major glands. It's formed by calcium, and it's often seen in x-rays. Treatment of a sialolith is either you milk the calcification from the duct, or you have to require surgical removal to get it out. So here's an example of it. You can see in the radiograph it's that big white area, and it's white because it has calcium in it, so it picks up on the radiograph. And basically, again, it's just little calcium stones that plug up the ducts, and it stops the gland from secreting saliva. So what can a sialolith turn into? A sialolith can turn into a ranula, which is a plugged up salivary gland that's trying to produce saliva, and it changes increasingly in size based on the amount of saliva you have. So you can see on the lower mouth, the floor of the mouth there, it's all bulgy like a frog, and it's a ranula, which can occur from a sialolith or from trauma. Okay, and now we have acute and chronic sialadenitis. This is painful swelling of the involved salivary gland due to obstruction of the salivary gland duct. It may result as an infection. How do you diagnose it? Well, you may have an involvement of injection of radiopaque dye into the gland, and then you take a radiograph, which is the sialography. How do you treat it? You need antibiotics. So this is the most common infection we see with mumps. But again, it's acute or chronic sialadenitis, painful swelling of the involved salivary gland. Okay, so those are our injury to soft tissues. Let's review them one more time. You have hematoma, which is accumulation of blood and tissue to trauma. Frictional keratosis, which is extra keratin developing from friction. Nicotine stomatitis, which is the little bumps or dots on the palate of the mouth from heavy smokers. And there it is again. Tobacco patch keratosis. It's when you see a white lesion located on usually the mucobuccal fold, and it's from chewing tobacco. It's thick and corrugated. And amalgam tattoo, which is also known as argyrosis, and it's blue-black pigmentation of usually the lower posterior region of the mandible. Melanosis, which is tricky like an amalgam tattoo, but it's not. It's just a change in the pigmentation. Acetic cheilitis or solar cheilitis, which is the disappearance of the vermilion border of the lips from a sunburn. Mucocele, which is the blister-like or vesicle-like area that's plugging up a minor salivary gland. Necrotizing sialometaplasia. This is when the tissue is dying on the roof of the palate and between the hard and soft palates. There it is again, tissue is dying. And then sialolith is a salivary gland stone itself that's found in both major and minor and formed by calcium. You can see them on x-rays. And then what does a sialolith turn into? It can turn into a ranula, which again we see on the floor of the mouth. And then you have acute and chronic sialadenitis, which is the painful swelling of the involved salivary gland when the salivary gland duct is obstructed. Okay, that is our injury to soft tissue.